tuberous breast, in the terms of patients, is a deformity called goat breast deformity. Tuberous breast or tubular breast, in fact, these two deformities are deformities since birth. We often come across these deformities with the development of breasts at the age of adolescence. It can be a single breast, or it can be two breasts together, or it can be two breasts in different ways. There are degrees of these. When planning treatment, first of all, the patient must make a very good distinction between the tuberous breast deformity and the tubular breast deformity. Generally, these deformities are confused by our colleagues. So, both are called in the same way. However, the tuberous breast deformity and the tubular breast deformity are completely different. In the tuberous breast deformity, the breast is as long as a tube. The size of the breast is usually normal. In these breasts, we can usually do the operation of collecting the breast with an implant if necessary. But we often do the operation of straightening and shrinking. The tuberous breast deformity is completely different from the tubular breast deformity. Here, the base of the breast is very narrow. The breast is narrow in both length and width. The head of the breast is enlarged. The breast tissue is usually protruding from the enlarged head of the breast. Surgery for this deformity requires more experience and better planning. It is important to be done by the doctors who deal with this issue. Here, first of all, these deformities, that is, the narrowness of the base of the breast, need to be opened. The line of the place where the breast is usually located is positioned much higher. It needs to be restored to that position. Since the volume of the breast is small, we use implants to enlarge the breast. In other words, we use breast prostheses. Since the black area around the head of the breast is large, this area needs to be narrowed. The head of the breast needs to be reshaped. It is also very important to remove asymmetry on the opposite side. Patients need to know this very well. Tuberous breast deformity and tubular breast deformity are not the same deformity. These are different deformities, and the treatment plan of these deformities is also different. Patients need to know these and make plans accordingly.